My name is Erin Bonoski-Thomas. I am a research assistant professor in the School of Public Health at Georgia State University, and I'm also the Director of Health and Wellness at the Center for Leadership and Disability at Georgia State University. So our center is what's called a University Center for Excellence in Developmental Disabilities. So we're a federally funded center, and there are about 67 centers like ours throughout the United States. And the goal of our center is to engage in research and to translate research into sustainable community practices that aim to improve the lives for people with disabilities and their families. So it's a very broad mission, and we have lots and lots of projects, lots of funders and lots of projects that help us to work toward fulfilling that goal. So my work specifically is in, like my title says, I'm the Director of Health and Wellness. So I'm trained in public health. I have a PhD and an MPH in public health, and my work has been around disability health disparities. So understanding what it is about disability and living with a disability in the United States and in the world that makes people experience lower quality of life and poorer health, and what we can do to alleviate disability health disparities and work toward health equity. So I guess in March, at the beginning of when we sort of started to understand what the pandemic looked like, what COVID-19 was looking like, and what it might, develop into over time. Of course, we had no real idea how long we would be sort of dealing with it. But we, at the center and within our national network, we started to see a lot of information come out about how people with disabilities would be disproportionately at risk during the pandemic for several reasons. And so there was a lot of, well, in relation to other populations, there wasn't a lot of emphasis on how people with disabilities would be impacted, right? But within our network, there was a lot of information that had come out. We saw lots of emails, we saw policy briefs, and people really just starting to work on, what are we going to do, and how are we going to ensure protection for people with disabilities during this time? But what there was a lot less of was information about how people with disabilities would be impacted based on and separately from how the people that support them. So the research that we conducted had two major components. The first was an online survey. So we conducted an online survey of 61 people with intellectual and developmental disabilities and 76 direct support professionals in May of 2020. Most of the people who participated in the survey represented the state of Georgia. There was some representation of people outside of Georgia, but it was mostly people from the southeastern region of the US. And what we did in that survey is called a retrospective pre-test. So usually if we want to measure change, someone's change in something that we can measure by giving them a survey, we would give them a questionnaire or a survey before the thing happened, then the thing happens, and then we give them that same survey after the thing happens. So then we're able to look at the numbers to figure out if there was a shift in whatever the thing that we're measuring is from before the thing to after the thing. The problem with doing that in emergency preparedness and emergency response research is that we would have no idea that we needed to give a pretest, right? Because we don't know that this thing is going to happen. It's a pandemic and we weren't aware of it. So we used what's called a retrospective pre-test format, where basically after or during an event happens, you give both a pretest and a post-test at the same time. So you basically ask people to answer the questions twice. You ask them to answer questions based on what their lives were like before the pandemic hit, and then you ask them to answer the same questions again based on what their lives were like after an event, or in our case, during an event, because of course we had no idea how long this was going to go on for. The survey that we use is called the Quality of Life Questionnaire, and it has 10 questions in 4 different areas. So it measures 4 broad areas of quality of life, including personal life satisfaction, work competence and productivity, empowerment and independent living, and belonging and community integration. So those are kind of the 4 really broad areas of quality of life that we're exploring. The survey showed sort of exactly what any person who has experience working with people with disabilities, who is a person with a disability, who is a DSP, you would expect that people's quality of life has declined throughout the pandemic, and that's exactly what we found. We found that both people with intellectual and developmental disabilities and DSPs experienced statistically significant declines in all 4 of those areas of quality of life that we measured. So in general, surveys do a really good job of telling us kind of what's happening, just giving like a quick snapshot of what is going on. But surveys don't always do a great job of telling us why something is happening. And to understand why things are happening, we really have to talk to people themselves. We need to understand their perspectives. We need to understand their experiences and their day-to-day, especially in a pandemic situation where things really do change hour to hour, day to day. And so to understand why those changes in quality of life were occurring, we conducted virtual interviews, so using Zoom or another virtual conferencing platform, with 8 people with intellectual and developmental disabilities and 10 DSPs. And we did those interviews at 2 time points, so we talked to each person twice. The first was in July, and the second was in September. We asked people to very generally kind of tell us, what are you experiencing right now? What is your quality of life? What is quality of life to you, and how has it changed? We also asked people how their relationships have changed, how their relationships with people that support them or that people that they support, how those relationships have changed during the pandemic, and sort of what actions they're engaged in to help kind of sustain quality of life during this time together. We also asked people about resources that they have used, so anything that they've found that's been a helpful resource, excuse me. And then we also asked people what resources they felt like they've needed but have not been able to find. So those were the kind of major interview questions that we asked. And from the interviews, we found that people with intellectual and developmental disabilities really described, kind of above and beyond anything else, they described experiencing isolation. That was really the main takeaway. They described dealing with the effects of sort of major changes in their life routines and changes in those relationships with their support providers, who jobs may have shifted, right? So DSPs may be working a whole lot more hours, or they may be working a whole lot less hours, depending on kind of what their situation is. So they may be spending more time with their support providers, or they may be spending a whole lot less time with their support providers and getting less of the support that they need. Some people described instances in which their direct support providers had gotten sick, had gotten COVID, and sort of how that had impacted not only the support provider, but also impacted the person themselves. There was also kind of the last main finding for people with intellectual and developmental disabilities was that there's a real sense of fear and feelings of uncertainty about the future. There were people who kind of said, I just want someone to tell me when this is going to be over or how long this is going to go, because I need to be able to understand like when I'm going to get back to that routine or when I'm going to be able to see my family again or have access to those supports that I had before the pandemic that have now changed. The most substantial decreases in quality of life for people with intellectual and developmental disabilities occurred in the domains of work competence and productivity, and then in belonging and community integration. And so those kind of align with some of the things that we heard, particularly the area of belonging and community integration, when just those daily activities and routines and places that people go to feel included and to be integrated within community had shut down, right? They're not open. They're not open for business. And yes, a lot of activities have shifted to taking place on Zoom, but Zoom, at least from what we've heard, Zoom doesn't offer the same sort of sense of integration and sense of inclusion as sort of being physically within a community. I thought the finding for people with disabilities related to work competence and productivity was particularly interesting. The quantitative data, again, it shows us what's happening, doesn't really tell us why, but what we saw in the quantitative data that then kind of matched the qualitative data was that there were a lot of people with disabilities who just weren't working anymore. So they had jobs before the pandemic, and then their jobs were, either the entire business was shut down or their hours were cut or, whatever it was. So people didn't have that sense of being productive at work because they didn't have jobs anymore. So those were kind of the two specific areas that we saw real steep decreases in quality of life for people with IDD. The DSPs that we interviewed talked about a lot of the same themes, right? By and large, people are experiencing a lot of the same things, regardless of who they are. But specifically, DSPs experienced overwhelming burnout, and that's, shouldn't be a surprise to anybody, really, especially for the DSPs that we talked to who were working in positions where they live in the place that they work, so they live with the people that they support. Those DSPs described experiencing a lack of respite or a lack of time away from their jobs. They also described sort of a constant pressure weighing on them, not only to keep themselves safe just for their own health sake, but also to keep themselves safe so that they could keep other people safe, right? So that they didn't bring COVID to work was something that we heard, almost a direct quote by several people. So this idea that, someone else, not only is my safety my responsibility, but someone else's safety is also my responsibility, and I have to keep that in the forefront of my mind all of the time. The other major finding among DSPs, and particularly among DSPs who are members of populations that have been historically excluded on the basis of race or ethnicity, is extreme emotional distress that was related to living and working as a DSP during COVID, given sort of the ways that COVID has been racialized, the ways that it's been discussed as a racial or an ethnic virus, as a Chinese virus. That is the quote that was provided by one of the DSPs. And also the ways that sort of the timing of this pandemic has intersected with what one of our participants called a dual pandemic, a pandemic of racial violence and racial tension in our country, given that COVID has disproportionately impacted communities of color who are also simultaneously being impacted by violence and racial tension in our country. So that was another finding that I think was a little bit more, I won't say surprising, but at first we didn't directly ask questions about that, but as people started to talk about it, then we started to ask more questions about it, which is kind of the beauty of qualitative research, is the ability to kind of ask more questions over time as you gain understanding of an issue. And then for DSPs, the two areas that we saw the most substantial decreases in were personal life satisfaction and then also in belonging and community integration. So I think, again, that kind of goes along with both what we're finding and then with your comment actually that you just provided about like, these are things that are persistent in the life of a DSP, so would there even be change? And so the fact that the DSPs didn't have that substantial decrease in work competence and productivity, to me, goes along with the comment that you made, that sort of like, these are things that are just always present, they're persistent, burnout is persistent, and yes, it may be heightened during times of pandemic and the time of COVID, but the decrease that we saw, at least in the numbers, was not as substantial as other areas. I do think that the aspects that we discussed about racism and the racialization of COVID-19 probably played into that substantial decrease in personal life satisfaction that people reported. And then again, belonging and community integration. We talked to DSPs in the interview phase of the study that mentioned that, again, if they were living in the place that they work, they weren't leaving because it was dangerous. It was dangerous to them. And then by being dangerous to them, it was dangerous to the people that they were supporting. So they didn't have a sense of belonging and community integration because they weren't seeing their communities. They weren't being a part of their traditional community outside of work that they had previously had access to. So one of the sort of more general things that I'd like to talk about is the importance of including people with disabilities in research. Even when research is not necessarily focused on people with disabilities, right? Even if it's sort of like a more general research study about COVID-19, people with disabilities need to be represented in all research. And so for the people with disabilities and family members who are part of your audience for this, thank you for participating in research, because it's one of many important ways to create change It's not the only way, and it will never be the only way. But being able to talk with a researcher and provide your story and provide your perspective and experience can just sort of add another piece to the puzzle of moving forward. And like you said, moving the needle on disability issues at a broader level. So thank you for participating. And I think, you know, there's a lot that goes into choosing to participate in a research study, but I encourage people to continue to fight for representation in all areas of life, and that includes within research. So if there's any research studies that are, you know, being done in the state around COVID that aren't including representation from people with disabilities and their families and direct support professionals, continue to advocate for that, because that's how we understand what's going on, and that's how we can really make a difference.